Welcome back to the Educated Associate YouTube channel, where we continue to discuss anything and everything related to associate dentists. Today we wanted to dive into an important conversation: associate pay structures. Now, there are a number of varieties out there, but there are 5 main types, and I've personally worked 3 of these types. Let's go ahead and dive right in because there's a lot to discuss. Now, simple production is pretty much how it sounds. It's very simple, it's very straightforward, and it's easy to monitor and follow and track as an associate and as the owner. That tends to be why this type of pay would be chosen over the other types, is just for simplicity. How this functions is, let's say a filling in your office costs $100 to be done on a back tooth. Now, that's known as your UCR fee. Let's say that the associate dentist working in this office completes 10 of those fillings in a pay period. So the $100 filling multiplied by 10 times is $1,000. So for the total amount of fillings they did in the pay period, they produced $100. In most cases, associates are paid a specific percentage of their overall production. That number tends to be somewhere between 25 and 35%, and the exact percentage you get is based on your negotiation skills, your level of experience, and really where you live within the country. Let's just say, for our example, our associate is getting paid 30% of that $1,000. The associate would receive in their pay period a $300 amount, of course, pre-tax. Now, the next model is an adjusted production-based model, and this tends to be favored by practice owners because it would allow a period for adjustments to occur. Now, adjustments are really a fancy way of saying reductions to the associate's pay for monies that the practice was unable to collect. Now, that's not to say the practice isn't doing their job and collecting money. That could mean several things. Number one, it could be money that was not obtained from the patient. It could also be monies never received from insurance carriers. Heavily insurance-based practices tend to have lots of adjustments done to their associates' pay, and we'll dive into why that is next. So if we continue from our previous example where a filling, cost $100, let's say that's your UCR fee. Now, in an adjusted production model, let's say the associate dentist completes 10 fillings over the course of a pay period on Delta Dental type patients. So giving it our 30% rate again, the associate dentist would get $300 pre-tax. Again, very similar to simple production. Now, this is where the adjustments occur. Typically, insurance companies reimburse the office somewhere between 14 and 30 days after the treatment is completed. Now, Delta Dental has reimbursed your office $80 for those 10 fillings. So they've reimbursed your office $800. In this case, the office has already paid you like they received $1,000. So there's kind of a $200 discrepancy based on the overall number they were anticipating and what they received. This is where adjustments occur. In this case, they would reduce your future pay not by $200, they would take 30% of $800 and then subtract that from what they paid you, and that would be the amount adjusted off of your future pay. Another benefit for the owner, other than not having to have paid you for this, is that they typically use the money not reimbursed by insurance as a tax write-off within their own corporate taxes. The advantage for the associates is it's fairly straightforward to follow, but just be careful to read every word within your contract to make sure they're not allowing adjustments for things that are completely outside of your control. The next type of pay is a collections type pay. Now, in a collections-based contract, the difference with an adjusted production-based contract like we just talked about is, in the previous example, the associate was paid initially. So in that initial pay period, they did receive a paycheck even though that the office has not obtained reimbursement from the insurance carrier. In a collections-based model, the associate never gets paid until the office actually collects the money. So in an insurance-based office, this would mean that the associate is compensated maybe 2 to 3, 4 weeks down the road after they completed the procedure. Now, the advantage to the office is they never have to adjust anything. There's no extra math. It's just, hey, this is what we collected. Here's your percentage. Here's what you get. So it's very, very straightforward to monitor and follow. However, anything that's not collected, you will never receive pay for. So while it's straightforward, it's not as beneficial for the associates as a simple production-based model. how a draw works is you and your company determine a figure that they're going to pay you in your pay periods. So let's just say for me, I had worked 2 years at a previous office. I had a rate that I was used to producing on average every month. I told my new employer that rate, and we made that my monthly pay rate. So let's just say they're going to pay me $14,000 a month via a draw. Now, over 3 months, they're going to pay me $14,000 a month. And at the end of that 3-month window, we're going to compare all the collections of the procedures I completed to the draw. So I just need to make sure that in those 3 months, I'm producing enough money to cover what they've already dispersed to me. Now, where a draw can get scary for new associates is when they've paid you more than you've actually been able to produce. Then you form what's known as a deficit. Now, there's various ways to handle deficits. Some companies just reduce your future pay, kind of almost like an adjusted production, to compensate for those losses. Other companies ask you for a check for that dollar amount that they've already paid you. Now, you pay taxes on the money they gave to you, so you got to be really careful with these things that you're not receiving a draw that's too high, because you're never going to get enough money back after taxes to pay them back. So that's kind of the scary thing with a draw. Again, personally, I've worked a draw. It's worked well. I tend to be very close to the amount they disperse me, or I form a bonus most quarters, which means they owe me money, and I just view that as a nice bonus I get every 3 months. So again, draws are not bad. They're not evil. They're just different. So that's something to pay attention to. Now, the last pay model is a salary. I've had a few colleagues that have been able to obtain salary-based contracts, but they're fairly rare. The reason is salaries they delete your need to want to produce and produce and produce. So more often than not, when I see a salary-based contract, it's either in a public health setting or government type work, where they just are going to have you see a certain amount of patients every day, regardless of what's going on within their mouth. So salaries can be great. It's very simple. You know how much you're going to get paid every pay period. It doesn't change based on how much you work. It doesn't change if you go on vacation. A salary is a great way to live your life. It allows a lot of predictability for you as an associate, which can be an excellent thing. So please comment with your experience and your working career as an associate. Have you received pay in any of these types? Which one did you find the most beneficial for you or you and your family? And as always, stay drilling, my friends.